Okay, hi. I'm Cathey Huddleston-Casas. I am joining you from Omaha, Nebraska. I'm at the Buffett Early Childhood Institute, and excuse me, I am the Associate Director of Workforce Planning and Development.
Hey everyone, I'm Jen Goettemoeller. I'm also in Nebraska today. I work with Cathey. I am a policy consultant for the Buffett Early Childhood Institute, and we'll be presenting with Cathey.
We're going to share with you today what we call shifting the paradigm in Nebraska. And I wanted to confirm that you're seeing just one slide and not the notes page, correct? Okay, because it's showing me something different. Okay, well, we also did a couple of provider surveys right at the outset of the pandemic, and I just wanted to share a couple of key points from our providers in Nebraska that mirror what's happening across the country. You know, just in July, a couple months after the pandemic hit, we had, 1 in 4 of our providers had seen their incomes reduced by over 50%. Half reported they were likely to close if the pandemic continues or worsens. And most would apply for financial assistance if it was offered. And these results have been used by partners within the state as they move forward with attempts to stabilize the early care and education in Nebraska. What Jen and I would like to share with you, though, is that we have been sitting in the midst of the perfect storm for this paradigm shift in our state, because we're in a context where you can see the child care industry collapsing. It was already in crisis before. We all are familiar with the way that the early care and education system is functioning without the resources that it needs to do the job that we've asked it to do as a society. The pandemic, one of the gifts of the pandemic has been that all of the public awareness work that we thought we would need to do to convince people that early care and education is in fact critical economic infrastructure has been done for us by the rest of the community seeing what happens when childcare is unavailable, whether you have young children or not. It impacts everyone. And the other piece of this perfect storm is that we have the groundwork of 2 ambitious undertakings. We're also a part of this context. And I want to invite Jen to just take a moment to give a little bit of background on the perfect messenger. So we have a partner who has worked with us on some of these this groundwork. Go ahead, Jen.
Sure. So our perfect messenger in the midst of this storm was the Republican chair of our Appropriations Committee. I say Republican chair, maybe I should have said the chair of the Appropriations Committee in Nebraska, who happens to be Republican. And he has been really a critical voice in all of this. In Nebraska, the legislature is a unicameral, which of course means that we only have one house. And so the chair of the Appropriations Committee is certainly someone who the rest of the body looks to with a lot of respect and kind of sets the tone and a bit of direction in terms of the budget in particular. And so he really played a very key role in all of this. And we'll talk a little bit more about his involvement, I think, throughout the presentation here. Maybe I will say one other thing. And that is he talked about having the obligation, that his committee has the obligation to set budget and policy decisions that will allow and encourage businesses to flourish, not picking winners and losers, but that this conversation was not about prioritizing the childcare industry over other industries, but about knowing how foundational childcare is to everything else Nebraska depends on economically. So that's the tone that he set with all of this, which was a great foundational piece for us to build on.
Thank you. So the slide that you have in front of you now is a lot of stuff not expecting you to take it all in, but I just wanted to try in a picture to show you all of the activity that had been happening. And I believe a lot of this type of activity is happening across the country for different reasons. I think a lot of it has been spurred by the Institute of Medicine, the IOM report from 2015 that talked about transforming the early care and education workforce, or the early childhood workforce. And then of course the National Academy of Sciences, same group, different name, released the financing report a couple of years later. On this page, what you see is on the top in the purple are the activities that the Buffett Early Childhood Institute has been involved in. And most of it surrounds the Nebraska Early Childhood Workforce Commission that we convened and worked with over 3 years, and to produce a commission report, as well as a number of other things that we'll talk about in just a few moments. The bottom of the screen shows you work that's been happening in Nebraska as a result of PDG. And so the preschool development grant that we received, and then the continuation. I know a number of states have been a part of this process as well. So we're going to start the story here, though, where the policymaker asks for the calculation. So I'll set the stage for you. Our commission was a collection of 40 leaders from across the state of Nebraska. We had members of the early childhood workforce. We had your usual cast of characters from the Department of Education, and as well as Health and Human Services. But we also had people from the business community and philanthropy, and folks that came in saying, not really sure I can offer you anything. And we assured them that we absolutely needed their perspective in our work. And so we had these quarterly meetings to set a vision for the early care and education workforce in Nebraska, and to establish some goals and recommendations around that. About halfway through, in September of the second year, we were having a meeting. We had already established work groups. I was directing the work group on efforts to fund early care and education. And I was so excited because it was the first meeting that we were having since the release of the Transforming the Financing report. So I was bringing the Transforming the Financing report to my work group and just sort of deconstructing it a little bit, and really helping to use it to say, hey, we're going to think about funding early care and education from this, cost-based, quality-oriented perspective. We're going to completely cover all of it, not just direct service delivery, which is the way that we typically talk about it. And so I nerd out. I make photocopies for everybody of these pictures, and I'm so excited. I'm showing them the that this total cost of quality is the guide of looking at everything that needs to be included, and that if you're doing quality, it's the same for every kid. You don't change it based on the setting, all of this, and also recognizing that how can we potentially estimate where we start. And I'm also really excited to share that we have that this mess of spaghetti is what I call it, is that we need to align systems, and so everybody is supposed to be following along and getting on board with this. Well, Senator Stinner was part of my work group, and he looked at it, and what he saw was, there's money in the system, there's a gap. How much more do we need to fill that gap? Where did my stuff go? There we go. So, I'm all excited about the technicalities of what's available in this report, and he sees the gap and says, let's figure that one out. Let's identify what we need in order to fill that gap. So that, was not necessarily a part of the plan for the commission report, but it became that afternoon, it became the plan. And so we shifted our focus from to doing the research to conducting the research in order to calculate this gap. And in order to do so, we, oh, I don't know where that went. In order to do so, where did it go? I'm sorry. I switched a slide. Okay. We had to figure out where did we have good access to good data. So I'm calling this the genesis of the technical report. We will talk about the technical report in just a second. I don't want to get too caught up there, but really what we needed to do was turn to the best data that we had available. And that was to call up Jen and say, you're the person who knows where all of these different pots are. You know how to read these budgets, you know how to look at these public documents, and you've got the relationships to call up people and try to figure this out. So Jen and I started working together, and Jen really was fantastic with the data. And then I used that data to generate estimates for Nebraska's current investment. So, and I can talk more about that at some point if people are interested. But I'd like to, at this point, hand it off to Jen and let her talk to you a little bit about her process of where she was looking for the dollars and how the way that the financing report conceptualized total cost-based approach led the effort.
Mm-hmm. So we just ultimately, to start with, needed to know every single dollar that was going into our early care and education system. We decided to just focus on the public dollars. Private funding is something that we still haven't quite done yet, but we certainly have hopes to add to that. But we wanted to make sure that we were not just counting direct service funds that were in the system, but really using the quality-oriented cost-based approach that is found in the Academy's work. And so you can see those three pieces here that are just instrumental. And of course, it's very difficult. Sometimes a policymaker wants to know how much does it cost per child, and they're just thinking direct service types of things. And so part of shifting the paradigm is really helping everyone understand that all of these components are absolutely critical for getting to not only to financing early care and education and talking about any kind of cost associated with that. So then you'll see a picture here, an image here next of a little bit of that mess. So this is Nebraska's version actually of the spaghetti that Cathey had pointed out in the funnel earlier. These are all of the public dollars that are coming into Nebraska. It's not necessarily important that you hone in on all of these boxes and follow all the arrows. But we just wanted to, make a point about, of course, how complicated it is. Nebraska is not unique in this effort. Every state, is going to have their own spaghetti mess for sure. But we had to know in Nebraska to really start this conversation. We had to know where everything was going, exactly how much was in, and how the dollars flowed. That was actually very, very important. So you can see up at the top that we start at the federal level, things start to flow down into the state, and then they go through various different entities or organizations. And at the bottom, you end up with the providers who are actually receiving the money right at the end. And every state has these providers. You've got your licensed childcare centers, so on, till you get to Head Start, right? I would just direct your attention to maybe the arrows at the bottom that are going into all of our providers, those boxes at the end, because I know that our colleagues in California just pointed out that provider vulnerability really differed based on the funding stream. And so one of the things that was at the forefront of our minds when we were doing this work is just remembering that as a field, we know and understand that children have the same developmental needs regardless of which setting they're in, whether they're in Head Start or they're in a license exempt program or they're in a licensed childcare home or center or preschool program. Regardless of the setting, they have developmental needs that need to be addressed, and they don't vary by setting. And in a similar way, providers have the same need for funding stability, regardless of what setting that they are practicing in. But these arrows are showing different funding streams that are available. And you will notice that some of the providers at the bottom have fewer funding streams available to them. Some of them have quite a number of arrows going into the box, but it might be a little bit deceiving because it's very complicated to get to some of those dollars. There's so many ways that the funds can go in, but they don't know how to access them. And especially if, they don't have the capacity internally to have someone focused on how do I navigate any revenue streams that may be available to me. So just a little bit of a mess. And then before we move on, I'll just ask Cathey if she wants to add anything here to the discussion on this slide.
I don't, but I did insert a slide, Jen, for us to move from this to talking about the LR 390. Since I had mentioned that I used those numbers to generate estimates, I thought it would be fair to share those estimates with you. So, and this is information that's reported in our Early Childhood Workforce Commission report. But really what I just wanted you to see is that we identified the public sector dollars to $211 million is the information that Jen identified for us with the research. And then we were able to estimate some other numbers from there. And then in order to fill the gap, we applied assumptions that are made in the financing report to our data. And so this information put us in the position to engage with policymakers around this. And so the two light blue slices of the pie to the right, which is just the public dollars, that's where Senator Stinner was focused. That was the number that he wanted, was, okay, so we're putting in 76.7 million right now. What do we need to be putting in order to get to where we need to be? And so that estimate, and we could talk about that estimate is around $108.5 million more of funding per year if we were only functioning in 2017 dollars in a 2017 economy. So, but Jen, this will take you, so that moved our conversation to the interim study.
So Senator Stinner, as Cathey had mentioned, was the one who asked for the that calculation. What's the gap? What are we putting into our system now? So all of this was happening prior to COVID. And when COVID hit, we knew that we needed to keep our focus on the long-term systems change, specifically around public funding, but we had to do it in the midst of a pandemic. So we already kind of had the momentum going towards how do we have a discussion at the state level with our policymakers about fully funding an early care and education system. So we were kind of moving that way, and then COVID hit. So we did a quick little flex in the moment, and Senator Stinner introduced this interim study called Legislative Resolution 390. Now, legislative resolutions, or LRs for short, take on two forms in Nebraska. The first is a more congratulatory or ceremonial type of item that's introduced, and it's congratulating someone or again, making it a certain day in the state of Nebraska. The second type of LR is an interim study. And this is a study, but it doesn't mean what those maybe in academics or research are used to. An interim study in Nebraska is a tool for gathering information, building a persuasive case, and if successful, gets the attention of the entire legislative body as a precursor for forthcoming legislation. So that's what we had asked Senator Stinner to work with on. And of course, we're working with other partners in the state, especially the kind of the lead early childhood systems policy advocates in the state, working very closely with them on all of this. You'll see a list of components to the LR as well. All of these were very, very important. So we had the provider surveys that were done in March and June. We had local input of parents and business owners. Actually had worked with Senator Stinner's office, and he sent out an opportunity for parents all across the state, businesses all across the state, to talk about what is it, how is COVID impacting your business and your family, and whether you can even have access to childcare or not. Then we had also about the same time a report that was released by First Five Nebraska that quantified the economic fallout of insufficient childcare, and it showed about $745 million in direct losses, not even counting the indirect losses. And we've seen reports like these. I know a number of states have done these kinds of things, but again, this is kind of the information gathering that we're doing to build the case so that we can keep our eye on that long-term systems change that we really need to. Another component of the LR was the technical report that Cathey had just mentioned. This is the report that captures all of the public funding that is going into the early care and education system in Nebraska. And then we had these two hearings, one hearing of the Appropriations Committee, one briefing of the Health and Human Services Committee, both committees within our legislature. This is really where we were hoping to have the paradigm shift, rubber meets the road kind of thing. So previously in Nebraska, over the last many decades, as advocates and others come to the legislature and they talk about early childhood and they talk about the investments that we need to have there, I think historically those conversations have revolved around how many number of children do we have, how many children of those are at risk, and what kind of money do we need to invest in the system to address what children need. The paradigm shift that we were doing here with 390 was to approach early care and education with arguments about the size of the economy and not necessarily about the number of children that we have, because of course you've all seen it in your own states, policymakers making some assumptions, some judgments about certain kids and if their families are worthy or working hard enough or whatever the case, right? So we wanted to take it completely out of that realm and talk about what is Nebraska's economy, what do we need to have, how do we get through a pandemic and get on the other side of COVID-19 from a position of strength economically, and what size of economy do we want to have? What size of economy do we aspire to? And so the goal here with these hearings and briefings of the Appropriations Committee and the Health and Human Services Committee was really to get them thinking about the HHS Committee in their jurisdiction of building the system, an Appropriations Committee then funding the system that is based on the size of the economy that we want to have here in Nebraska. So this is a big paradigm shift. We didn't accomplish it all in 390. We got it started, and I know we're going to need to talk about that and continue to move that right, that you've got to hear it 7 times before it kind of clicks, sort of thing. And so we're in the beginning of this, but it did capture some attention of policymakers who had not thought of it in this way before. So we're starting to see some minds move a little bit in their thinking. And then Cathey, if you want to just, yeah.
And I just wanted to add that paradigm shift, even though that's where our minds were, it hadn't been articulated until COVID hit. And we were planning to try to bring this conversation forward anyway. And so here I am trying to figure out oh my God, I've been making this whole argument that we should base our early care and education financing levels, we should connect those to 0.75, 1% of GDP, right? As an estimate. And then we can dig down at the local level and figure out what that really looks like. But COVID hit and now our GDP is shrinking. So am I going to go out there and make the argument that, well, we need less now? But so we flipped it and said, well, you know what? We're trying to grow our economy in Nebraska anyway. So why not turn it around and say, we need 0.75, 1% of GDP to support an economy of that size with an early care and education system that we know meets the needs of the workforce that provides it and the children and families that depend on it.
Yeah. So again, keeping the same long-term systems perspective that we've always had in mind, but just shifting some things in light of the pandemic. So let me apologize for the amount of text that is on this slide, but I did want to actually leave the word for word, the recommendations that the Appropriations Committee offered to the rest of the legislature in Nebraska. So a lot of great stuff in the interim study report that people can dive into if they are interested in taking a look. But ultimately, these are the four things that the legislature received from the Appropriations Committee. The first one is really appreciating the members of the early care and education workforce, right? And everything that they do for families and all of us in the workforce. The second one is acknowledging the essential role that that workforce plays in our state's economy. So again, bridging the that link to the economy and how dependent we are on the workforce. The third one, we really start getting into a little bit more of the policy pieces to fund the system based on the size of Nebraska's economy, or the size of the economy that we want to have, which is very important and kind of a key piece to have in here. And the fourth one is around financing options. How do we, knowing that we have a gap, how do we start to fill that gap, and what kinds of things might we have at our disposal to doing some of that, which of course takes some great thinking. And at the time that these were recommended, we certainly didn't have recovery dollars coming our way or anything, right? So we've got some momentum and some opportunity there. And then Cathey, if you want to hit the next slide here.
Do you want me to hop past this one?
No, this is fine. Well, maybe. I mean, I don't know. I just would say in our technical report that Cathey had talked about, we tried to clean up the spaghetti mess and make it a little bit more legible and easier to follow. And so it's hard for you to see now on your screen, but all of these are numbered so that you're able to see funding and that sort of thing. So 390 has been, of course, the report has been submitted to the legislature. So now it's, we're at the place where that was wonderful. And now what? What are we going to continue to do? So the academies, as they set out the concept here, this is kind of the next phase, which is about aligning financing mechanisms. And I just wanted to mention a couple of things that are happening in Nebraska right now that I think are really making this work come alive and be seen. And that is a governance and financing task force that is led by First Five Nebraska with the intention of creating a fully financed, integrated, and comprehensive mixed delivery system. And so we are doing a lot of different activities, funding catalog, where we are going deeper into all of the funding streams that we track the flow of, that we can utilize to analyze where are opportunities so that we can better cover the cost of quality if we do the aligning, the braiding. Again, kind of back to our colleagues in California's point about making providers less vulnerable based on, the funding streams that they receive and that sort of thing. And we certainly ultimately hope to get to a place where we don't just align funding, but we actually have a shared leadership approach in Nebraska is kind of where we're going. within that governance and financing work so that we can really better cover the cost of quality. This is about, regardless of the setting that parents choose, that they have access to full day, year-round, high-quality care for their young children. And so with the governance and financing work led by First Five Nebraska, as well as the child care recovery funds and the advocates and private and public partners that are working on developing the plan for that, that's where we are heading. So I think that we have a few minutes for questions, and we'll just leave it to you all.
That's great. We do have about 10 minutes. If anyone has any questions, you're welcome to put them in the chat, or you can unmute yourself if you'd like to just ask them directly.
Maybe I will offer that one of the challenges that is not unique to Nebraska in this work is having those champions, those policymakers that are champions. And you know, the particular senator who has been so instrumental in our work here will be term limited pretty soon. And I know that that's not something that is just unique to our state, but it is kind of always on the forefront of people's minds here about how we retain those champions and cultivate new ones as people are facing moving on to their next steps and not having them in the legislature anymore, that sort of thing.
I don't want to exit out of here and go search for and grab a link to put into the chat button. But I do want to say that both the technical report and the commission report, as well as the link to the LR 390 interim study, which is a collection of all of that, are all available on the Buffett Early Childhood Institute website. And so all of those things can be accessed pretty easily there. Thank you for joining us.
Thank you. Thanks.